Hi, my name is Lara, and I'm a social worker at Rush University Transplant Program. I want to talk with you about being evaluated for an organ transplant. After you contact Rush to start the evaluation process, we'll review your information with you and request any outside medical records needed for your visit. All patients need to be evaluated by the transplant team to determine if you are a candidate for transplant. During the evaluation, you will meet with dedicated members of the transplant team. The transplant coordinator will provide education on the evaluation process, the organ transplant, and what to expect after transplant. The transplant surgeon will evaluate and determine which testing you need to complete. The transplant pharmacist will assess your current medications and compliance and provide education about medications you will likely take after transplant. The transplant social worker will focus on things you need to have after transplant, like social support, mental health, insurance, and returning to work. The transplant dietitian will provide education about maintaining a healthy weight and nutritional recommendations. The financial coordinator will review your insurance coverage and out-of-pocket expenses you may have. The transplant nephrologist and/or hepatologist will review your medical testing and make recommendations for additional testing. The evaluation also includes lab work, diagnostic tests, and other screening tests or procedures as required by the transplant team. Depending on your health, you may be referred to other specialists for mental health, heart, or diabetes care. If you have any potential living donors, we encourage you to bring them with you to the appointment, in addition to the person who will be providing you support after the transplant. After your evaluation and testing is completed, the transplant team will discuss your transplant candidacy, and the team will contact you with the decision. Our goal is to help you complete the evaluation process as efficiently as possible and move to the next phase in the transplant process.